Good morning. My name is Delina Malo Jubera. I'm a nursing student in second year. And now I'm going to give handoff report on the patient that I had yesterday. I need to give two identifiers that would be in accordance with hospital policy. For that, I would give his name and date of birth, which I'm not going to do here for the purpose of this video going public, but he's a male, 79-year-old. He presented to the ER on 9/15 with chest pressure constant and persistent. He was diagnosed with an NSTEMI, which stands for non-ST elevation myocardial infarction, and his EKG was a normal sinus rhythm with PACs. So that was the primary diagnosis. And relevant past history, he has coronary artery disease, aortic stenosis, mitral stenosis, hypertension, hyperlipidemia, cardiac catheter, and put in 2014, chronic kidney disease stage 3. He has no history of smoking or drinking. His vital signs as I left him was blood pressure 132/71, pulse 76, oxygen 96% on cannula at 2 liters, respirations 20, and temperature 97.5. Relevant lab values. APTTs are taken every 6 hours because he is on heparin drip. First value that morning was 42, the second was 60, and if he has another one that is 60, which means within therapeutic value, then we don't need to recheck it again on only every 24 hours. His mental status was slightly confused with a bit of memory problems, and his tele showed normal sinus rhythm with block with PVCs. He is on oxygen by nasal cannula, 2 liters. His diet is healthy heart diet. He ate 100% of his breakfast and lunch. As far as his ADLs and activity, he's a standby. His skin was warm, dry, pink and normal, no edema. And he has occasional chest pain, which has been controlled with nitro, and the doctor also ordered morphine 2 milligrams as needed. During my shift, he needed it twice. His lab values, they're all, a few are normal, a few are high, and a couple are low, but they are all trending in the right direction. Looks like the most relevant is troponin, and that was 1.18. And his APTT showed first 42, then 60, and if he has another one within the therapeutic value, we don't need to recheck it every 6 hours, but every 24 instead. As far as what I suggested for the plan of care, given the state of his heart and the fact that he chose to treat his condition with medicine only and not surgery, I suggested he get palliative care consult. He is stable now and he's possibly going home the next day. He is given Lasix to get rid of fluid in his lungs. By the way, he had crackles, but they were getting better. He got given Plavix to prevent blood clots and keep blood vessels open after a procedure. He had a cardiac stent done that day, the day he presented. Imdur to prevent chest pain And the rest of the medications that were given to him yesterday was metoprolol, amlodipine, aspirin, cyanobalamine, and melatonin, nitroglycerin ointment. And that is it.